Many people experience waking up due to urination after they've fallen asleep. This is referred to as nocturia. Nocturia is waking up from sleep to urinate, and if you have to get up from bed to urinate more than once at night, it can be diagnosed as nocturia. Following this criterion, it seems like almost everyone might be a nocturia patient. Because nocturia is so common, many people don't consider waking up due to urination during sleep as a serious issue. However, if you find yourself waking up due to urination 2 or more times in a night, especially if it makes falling back asleep difficult, it can be recognized as a significant problem. About 69% of men and 76% of women over the age of 40 experience waking up at least once during the night to use the bathroom. 50% of men aged 70 and older wake up at least twice at night to urinate. In the elderly, approximately 80% to 100% experience nocturia. When nocturia occurs, frequent waking due to urination leads to reduced sleep time, fragmented sleep, and difficulty falling back asleep, resulting in decreased sleep quality. Approximately 20% to 30% of people wake up once due to nocturia during sleep, 40% to 50% wake up twice or more, and 60% to 70% experience reduced sleep quality and overall sleep time with 3 or more instances of nocturia. During 7 to 8 hours of sleep, only about 20% of daily urine production occurs. Given this low production rate, we shouldn't be waking up frequently due to urination during sleep. However, if more urine is produced at night, if the bladder's capacity to hold urine is reduced, or if various sleep disorders such as sleep apnea occur, nocturia is more likely to happen. Let's explore cases where excessive urine is produced at night. Most commonly, this can occur with increased fluid intake, conditions like diabetes that lead to excessive urine production, or abnormalities in kidney function, which regulates urine. Medications such as diuretics can also contribute to increased urine production. Considering situations where urine production is notably higher at night, one scenario involves individuals with severe leg swelling. When people with significant leg swelling lie down to sleep, the fluid that has accumulated in the legs redistributes to other parts of the body, leading to increased urine production. Therefore, if there are conditions causing leg swelling, such as heart or kidney issues, nocturia can occur. It's advisable to promptly address the underlying cause of leg swelling to mitigate the occurrence of nocturia. As one ages, circadian rhythms tend to fluctuate and weaken. Even if one desires a specific sleep schedule, when the body's internal clock activates, it can lead to increased urine production. For the elderly, maintaining a consistent sleep rhythm seems crucial. Secondly, a reduction in the capacity of the bladder to hold and store urine can contribute to nocturia. Even if nighttime urine production doesn't increase, a decreased bladder capacity can lead to an increased urge to urinate, resulting in frequent nocturnal voiding. What could cause this reduction in bladder capacity? For individuals with conditions such as urinary tract infections, benign prostatic hyperplasia, overactive bladder symptoms, or the formation of bladder stones, bladder capacity may decrease, leading to increased occurrences of nocturia. Thirdly, it's noted that sleep disorders like sleep apnea can contribute to frequent nocturnal voiding. Patients with sleep apnea experience a relaxation of the muscles in the upper airway, specifically the base of the tongue, which obstructs the airway and causes the brain to wake up repeatedly during sleep, contributing to sleep disturbances. About 50% of patients with sleep apnea experience nocturia, and in severe cases of sleep apnea, this number increases to around 80%. The reason lies in the obstruction of the airway, causing a decrease in oxygen levels and an increase in carbon dioxide concentration. This, in turn, stimulates the sympathetic nervous system, inhibiting the secretion of vasopressin from the brain's pituitary gland, leading to increased urine production. Moreover, when the upper airway is obstructed due to sleep apnea, negative pressure is created within the chest. This negative pressure causes a decrease in blood leaving the heart and an increase in blood entering the heart. As a consequence, the increased blood pressure stimulates the atrial natriuretic peptide, resulting in even more urine production. To eliminate or reduce nocturia, it is essential to treat the underlying causes or conditions. Additionally, lifestyle changes can help mitigate the occurrence of nocturia. Firstly, it is advisable to reduce fluid intake before bedtime. Secondly, cutting down on the consumption of alcohol and caffeine in the evening can help reduce nighttime urination. Thirdly, elevating the legs slightly higher than the heart 1 to 2 hours before bedtime can be beneficial in minimizing the reabsorption of leg swelling and its conversion into urine during sleep. Fourthly, maintaining good sleep hygiene to avoid waking up in the middle of the night can also help reduce nocturia. It is recommended to stick to a consistent sleep schedule, going to bed and waking up at the same time on weekdays and weekends. Establishing a bedtime routine for about an hour every night can be helpful. If waking up and returning to sleep is challenging, practicing relaxation techniques such as the 4-7-8 breathing method can be beneficial. Lastly, blocking blue light, which inhibits the production of the sleep-promoting hormone melatonin, is essential. Avoiding the use of smartphones or electronic devices an hour or two before bedtime can contribute to an easier transition into sleep. Nocturia can increase the risk of falls, especially in older individuals. To prevent accidents, it's advisable to keep adequate lighting in the path from the sleeping area to the bathroom, such as using nightlights. Additionally, ensuring clear pathways by removing potential tripping hazards and using mats can enhance safety. For those with mobility issues, having a urinal or toilet bedside can be a helpful measure to avoid the urgency of going to the bathroom when waking up. I hope this video has been helpful. Subscribing and liking the video are a great help. Thanks for watching.